Hello everyone, my name is Nicolette Yarber, and for my Capstone 3 presentation, I will be talking about the importance of early diagnosis and early treatment of autism spectrum disorders. In addition, I will be touching on some things that parents should be looking out for, as well as steps to take if parents or caregivers feel that their child may be on the autism spectrum. Thanks for taking the time to listen, and I hope you enjoy. Let's start with touching on a general overview of what autism spectrum disorders are. Autism is a mental condition presented through a series of developmental delays that present themselves in early childhood. Autism presents delays in things like verbal communication, difficulties in tolerating breaks or changes in routines, sensory issues, motor delays, difficulty developing social relationships, and understanding the complexity of emotions. Being that autism is a spectrum disorder, it can be challenging for most to understand or even diagnose. Each individual with autism can be diagnosed with a varied level of severity from mild to severe, as well as many individuals having different combinations of symptoms as well. Clinical teams consisting of a psychologist and a pediatrician typically make the diagnosis of autism based on the criteria found in the Diagnostic Statistical Manual, or DSM-5 for short. A combination of symptom assessments, behavioral tests, observations, and questionnaires completed by parents or caregivers all contribute to a diagnosis of autism. Unfortunately, the diagnostic timeline for autism spectrum disorders is a bit off. Many medical professionals do not diagnose individuals until their third birthday, even when many symptoms and indicators of autism can be present early on in one's life. In fact, research shows that a successful diagnosis can be made between ages 1 and 2, even before the age of 1 in some instances. Though more and more research is bringing forth evidence supporting a confident diagnosis of autism can be made between ages 1 and 2, medical professionals still see the appropriate time for diagnosis to be around 3 years of age. This is unfortunate for many reasons. Early diagnosis from medical professionals can lead to early support like jumpstart therapies and family support programs to prepare for the potential life changes to come. So as a parent, what can we do with this information? What sorts of things can be done prior to a diagnosis to ensure that you're doing the best for your child? Noticing symptoms, monitoring milestones, and being aware of delays in your child's development are the first steps in getting your child the support that they need on time. With early diagnosis contributing to family support programs and varied intervention therapies early on in a child's life, pushing and encouraging diagnosis early on is important for so many reasons. Research has shown children at approximately ages 1 to 2 show the most advancements in their therapies. This can be due to the higher amount of neuroplasticity in the brain, allowing for more adaptability. Studies have been conducted following a group of children with autism that were between 18 and 35 months old for 1 year parallel to their treatment plans. Nearly 1/4 of these children earned a diagnosis higher on the spectrum, showing multiple improvements. Being placed in appropriate and rigorous intervention plans at an early age can lead to the child potentially reducing the severity of their symptoms and diagnosis. In addition, these therapies and support programs help provide coping strategies to help navigate through life successfully. The hope is that these successful research studies on the effect that early interventions have on children with autism spectrum disorders will lead to early identification and diagnosis. In addition, these early interventions can help reshape a diagnosis, leading to a more positive outcome and increased quality of life. So what do these early interventions and support programs have to offer? Aside from helping improve symptoms and diagnosis, early interventions and therapies aid in improving social skills, communication skills, play motor skills, increasing cognitive abilities, as well as aid in overall childhood development. With more families in recent years looking to start these interventions early on, specific programs have been developed that tailor specifically to the younger population of those 3 and under who are related to autism spectrum disorders. Children are not the only ones that benefit from these early interventions. Therapists who provide these therapies also give support, knowledge, and resources to families and caregivers to help with the challenges that may occur beyond therapy times. Implementing early therapy techniques in the home setting with multiple family members increases parental knowledge, understanding, and awareness. This leads to more consistency in the child's life, in turn contributing to a higher success rate in therapy. Better yet, early therapies can lead to inclusion into typically developing classrooms, promotes acceptance, understanding, and inclusion, increases social skills, and decreases rates of bullying. Overall, these early interventions aid in the development of a child and help children carry on the successes that they have through their lifetimes. As a parent, it is important to be aware of the sorts of signs and symptoms to be aware of. In addition to not meeting milestones at all, it is also not unusual for children to first meet milestones, then quickly regress in that area, losing the abilities. By a child's first birthday, if delays are seen in the ability to provide eye contact, socially smile with those in their environment, babble, respond to their name, or imitate others, it could be time to seek help from your child's physician. When working to detect and understand symptoms of a potential diagnosis, remember the 3 S's: speech, social, and sensory. From concerned parents with potential autism diagnosis for their child, difficulties in late onsets of language are the first trigger points for worry. Parents should keep a close eye on regression in speech abilities, delayed in verbal language abilities, little to no babbling as a baby, as well as regression of already learned language. In addition, language milestones at ages 16 months and 24 months should be noticed. If there are no one-word phrases by 16 months and no two-word phrases by 24 months, your child may have a delay related to autism spectrum disorders. Followed by language, social delays are early indicators that parents tend to notice early on. 1/4 of parents tend to see hindered play skills, little social interactions, or lack of motor movement while observing their child at ages 15 to 24 months. Parents should watch closely for little or poor social interactions, which can be seen through isolation, lack of smiling, lack of eye contact, or other shared gestures. An example of this could be a child playing in a corner by themselves and ignoring peers' attempts to initiate play. In addition, little interest in toys or playing with toys inappropriately are other points of concern. An example of this could be a child focusing on the wheels of a car rather than pretending to drive the car, or banging blocks together rather than building a tower with them. Finally, individuals that may have autism spectrum disorders may have sensory difficulties. Sensory difficulties can become apparent in a varied amount of ways. Some sensory issues are easier to detect, such as sensitivity to light, sound, or touch. Others can be a bit more obscure. Altered sleeping patterns, difficult eating habits, challenges tolerating change in routine, as well as repetitive vocalizations or movement, are also all sensory difficulties to be aware of. So now what? What are the next steps for a parent to take if they notice one or more of these points of concern for their child? The first step is to take action early. Seeking professional opinions at the first onset can really make a world of difference in your child's diagnostic timeline and success. If a parent or caregiver feels that their child may be at risk for a diagnosis of autism or another developmental delay, the best thing to do is to take your child into a visit to their pediatrician or general practitioner. They can provide guidance, recommendations, and support. Typically, if your child doctor sees it necessary, an evaluation by a clinical team consisting of a child psychologist, speech therapist, behavioral therapist, occupational therapist, and pediatrician will work cohesively with the parent or caregiver to determine what point their child is at. During the process of getting your child diagnosed, it is important as parents or caregivers to use all of the resources that are available to you. Websites, research articles, books, educators, diagnostic questionnaires, support groups, other individuals who have gone through similar situations, and medical professionals are all great resources to take advantage of. One thing that is really important to remember through the process of a diagnosis is that it is absolutely okay to seek multiple opinions. In fact, it's encouraged. Your child's well-being is the most important priority through this process, and getting them the support and interventions that they may need in a timely manner is crucial. With so many doctors waiting to diagnose into the age of 3, and with recent research contradicting that, saying diagnosis can be made earlier around ages 1 to 2, these multiple perspectives becoming more and more important. Do your part to use what you know. As I already touched on previously, utilizing resources that are readily available can benefit you and your family through the process. There are multiple programs designed specifically for parents and families in these situations. For example, a campaign created by the Center of Disease Control called Learn the Signs, Act Early is designed to inform parents of specific milestones for their baby or toddler. In addition to utilizing these resources, it's important to apply what you know. Being present with your child, applying feed techniques learned in the home setting, and aiding in their flourishing development may help as well. Talk to your child to aid in communication and language skills. Make social situations common and routine, and encourage diversity in your child's overall routine. As a parent, it is important in any situation to act proactively rather than reactively. Same goes for this situation. The The best way to be proactive in a situation such as this one is to be actively present in your child's life. For example, taking them to their regular scheduled checkups, especially during this developmentally crucial point in their lives. Work proactively to receive an appropriate diagnosis if you see any differences in your child's overall development. As a parent, it is important to follow your instincts in doing what you feel is right for your child as well as your family. In addition, use the resources and programs made available to you in order to aid in your child's successful development. Remember the importance of developing research to keep up to date on current facts. With proper and thorough interventions, development can be significantly impacted in a positive way. Though much more research can always be made, it is important to remember that the earlier the diagnosis, the better, and that an early diagnosis typically leads to early interventions. Early interventions have many benefits not only for the child themselves, but as well as their families. Finding out your child has autism can be challenging emotionally, physically, and financially. Having this access to support and services is crucial for your family's health.